I'm Dr. Bhuvneshwari, working as assistant professor in AGM Ayurvedic College, Hubli. So, the very first question why I chose this topic today for the webinar, that is the Ayurvedic management of cholelithiasis. Is it necessary to intervene such diseases in modern era? So, my answer would be yes. Why not? In this modern era, high levels of stress and strain precipitated by urbanization, socio-cultural and lifestyle modification, irregular dietary habits, and diminished physical activity has led to resurgence of various non-communicable diseases, which are fatal in nature and can be prevented. Hepatobiliary disorder is one among them, and cholelithiasis is the most common disorder or can be said as most encountered diseases in OPD labels. So, gallbladder stones are nothing but which are lodged in the duct can cause the blockage, resulting in severe life threatening complications such as inflammation and infections, pancreatitis, cholecystitis, and ultimately cancer. So it is the time like we have to give the treatment for such disorders. So the treatment modalities so far designed have good results but comes with few side effects, and surgical removal has complications and it is not the solution in every patient. So the conservative therapy still continues to be the solution for all the reversible ailments. So let's start with the understanding of cholelithiasis. This was the need. So, what is cholelithiasis? It is the presence of the stones in the gallbladder, where col means the bile, lith means the stone, and iasis is the process. Gallbladder stones are the concretions that form in the biliary tree. Usually, the gallbladder, when the usually in the gallbladder, when the chemical compositions of the bile becomes imbalanced, leading to the crystallization of the components. Example, the components of like cholesterol, bilirubin, bile salts. So what are the causes? The first one is the supersaturation of the bile. What do you mean by supersaturation? So super saturation of bile with cholesterol, the nucleation of cholesterol monohydrate with subsequent crystal retention, resulting in stone growth and abnormal motor function with or uh, delayed or emptying or the stasis of the bile. So first of all, what is bile and its role? It is a digestive fluid produced by the liver stored in gallbladder which aids in the fat digestion. It contains water, bile salts, cholesterol and bilirubin. Okay. So first is saturation of supersaturation of the bile. If the bile contains too much of cholesterol or the bilirubin or too little bile salts, it becomes supersaturated. Means the gallbladder stones are forming and we are going on adding sugar or the salt. And when that is cooled down, we can appreciate the crystals forming because that is not completely dissolved, but it is in the solvent. That the similar is happening here. The cholesterol and the pigmented molecules begin to crystallize, which will form the gallbladder stones. The second one is nucleation. Crystals from around the Crystal forms around the nucleus, often the mucus or the cellular debris. These tiny crystals dump together, forming microscopic stones. Okay. The third one is grow large and stick together. All these crystals forming after the supersaturation of the bile, they tend to stick together. Over the time, they form stones ranging from grain sized to the golf ball sized. The fourth point is gallbladder motility. So, gallbladder motility issue, if the gallbladder does not empty completely or the flow is stopped, it is not continuously flowing, the bile gets stagnated there. So it will promote the stone formation. We can appreciate in the persons having obesity, because there will be reduced response to the cholecystokinin hormone, which reduces the motility of the gallbladder. The fifth point is the mucus hypersecretion. The excess mucus in the gallbladder can trap the crystals and accelerate the stone growth. We can see this in the So these are the main reasons why the gallbladder stones are forming. That is supersaturation of the bile, the nucleation, the growth and the aggregation, gallbladder motility, and the mucus hypersecretion. We can appreciate these things in the fasting persons, rapid weight loss, intake of calories, fats, and in the pregnancy. So, coming to the types of gallbladder stones, there are mainly three types. The first one is cholesterol gallbladder stones, the second one is pigmented, the third one is the mixed. What is cholesterol? The composition of cholesterol stone is mainly the cholesterol. The common causes for this is high fat diet, obesity, and increase in the estrogens. And the second one is pigmented stones, which is appreciate the composition of pigmented stone is the bilirubin, which is appreciated in the liver disorders, hemolysis, and in infections. The third one is the mixed stones. The content is cholesterol as well as the salts. It is the combination of the all the factors, the cholesterol and the pigmented ones. So I would like to add the relevance of four F's we encountered in cholelithiasis, that is female, fatty, forty, and the fertile. As we know, females are prone for the cholelithiasis because estrogen and progesterone hormones. Estrogen increases the liver secretion of the cholesterol into the bile. Two, which does the supersaturation, and progesterone, it reduces the gallbladder motility. And in pregnancy, there is elevated levels, both the estrogen and the progesterone. And in obesity also, there is increased cholesterol production. That's why the female, fatty, 40, and the fertile uh, are the more prone for gallbladder stones. Coming to the signs and the symptoms. Often the gallbladder stones are asymptomatic. It is the incidental finding for the patient. Next, in symptomatic cholelithiasis, there might be presence of mild dyspepsia to nausea to vomiting. The person may be presenting with the dyspepsia or the nausea or the vomiting or the abdominal discomfort. We can say it as bloating. To biliary colic to jaundice. So there will be fatty food intolerance and flatulence and infrequent episodes of biliary colic. That is the severe steady pain in the epigastrium or in the right upper quadrant region, which is radiating into the interscapular region or the tip of the right scapula. And if the bile ducts are obstructed, so there you can appreciate the jaundice, and in cases of inflammation there might be cholecystitis. So in jaundice you'll appreciate the clay color stools, and the fever is the common thing. So this completes the signs and symptoms. So coming to the investigations, what we can do to like diagnose the gallbladder stones. The first one comes the abdominal ultrasound. There will be bright spots in the gallbladder lumen that are gravity dependent. That which means when the patient changes his or her position, the stones tend to move. They are freely flowing in the lumen of the gallbladder. The next one is the city. Next, the MRCP, magnetic resonance cholangiopancreatography. there will be image of the entire biliary and pancreatic duct. And in cases of uh, co- common bile duct obstructions or common bile duct stones, we should go for the MRCP to know the route where it is blocked or it is blocking the common bile duct. The fourth one is ERCP, that is endoscopic retrograde cholangiopancreatography. Endoscopic retrograde cholangiopancreatography. It is both the diagnostic and the therapeutic measure where the bile duct is visualized under the dye and simultaneously the stones are removed. Next, coming to the hematological findings, in CBC, there will be elevated WBCs, which signifies the inflammation. In LFT, there will be increased ALP, alkaline phosphatase, and ALT and AST, which indicates the inflammation or the blockage which is affecting the liver functions in cases of cholelithiasis. Next, there will be elevated bilirubin in cholelithiasis. Next, we can go for CRP. Again, it will signifies for the inflammation. Then pancreatic enzyme test, where gallbladder has been gallstone has blocked the pancreatic duct and leading to pancreatitis. The stone will move and it will block the pancreatic duct, which leads to pancreatitis. In such conditions, we can go for pancreatic enzyme test. Next, coming to lipid profile, there will be elevated triglycerides and it is a risk factor for gallbladder stones. There will be impaired motility of the gallbladder, and in low HDL there will be risk for developing the gallbladder stones. And similarly, as in the elevated total cholesterol also, it is a risk for gallbladder stone. So that's why we can go for this all investigations whenever we feel that the patient is encountering such symptoms of gastric region. So, understanding of Pittashaya Ashmari in Ayurveda terms, how we can understood what is Pittashaya Ashmari, where we are getting the reference of Pittashaya Ashmari. We doesn't have such direct reference for Pittashaya Ashmari. We'll get Ashmari in that Ashmari types will encounter the Pittaja Ashmari. So, how we can understand this Pittashaya Ashmari? The first one, we can include all the Pitta Pradhana Kafanubandhi disorders under this headline. Next, the Ashmari. So, it will give us a, gross idea how to understand and how to treat Pittashaya Ashmari based on these disorders like Pitta Pradhana Kafanubandhi disorders and the Ashmari. So first, the Ashmari. We'll get reference from Charaka, Vagbhata and Shushruta that the Ashmari forming in the human basti, it can be correlated with the Gorochana forming in the cow. So Gorochana is formed in the gallbladders of the cow, which is uh, which is taken as the Ashmari forming in the Basti. So we get an idea that Acharyas had the idea of forming of stones in the Pittashaya, that is in the gallbladder. Next, coming to the Rasatarangini. In Rasatarangini, we get the Acharya has, while mentioning the Lavana Bhaskara Churna, he mentions that Pittashaya Gatam Pittam Shushkam Maruta Kopataha Kuryat Shuladikam Goram Pitta Shosha Tadyuchate. He means that uh, there is Pitta Shosha. He is mentioning the term of Pitta Shosha. It is a condition arising due to the invasion of the pitta in pittashaya by vata, resulting into the drying of the dravaguna of the pitta. Due to the increase of vata, there is the drying of the dravaguna of the pitta, causing the excruciating excruciating pain. That is goram pitta shosha tadyuchate. There will be shula adhikam ghoram, and there will be pitta shosha. So we can take it as the Acharya is mentioning that whenever there is a stone formed in the Pittasha, it will lead to severe excruciating pain. That is nothing but the biliary colic, which uh, may be present from few minutes to several hours. Next, we get the reference of Pittashaya from the Shushruta that Acharya has mentioned Saptashayas. In there, we'll get the reference of Pittashaya. Okay. The next disease is Shakashrita Kamala. We can take it under the Pitta Pradhana Kafanubandhi disorder. In Shakashrita Kamala also, due to the sevana of Pitta Vardaka Ahara, the Pitta Vruddhi takes place, which the vitiated vayu by the action of kapha, that's the obstruction of pitta dosha entering into the koshta. There the pitta flows into the extremities, that in the shakha. So we can compare it with the, or we can correlate it with the obstructive jaundice, where the stone is obstructing the bile duct and it is causing the jaundice. So similarly, we can compare it with the Shakashrita Kamala. Next, in Pittaja, Gulma also, and in Ashmari, we can outline this all various Pitta Pradhana disorders and understand that this is this can be correlated with the formation of gallbladder stones. That is the Shakashrita Kamala, the Ashmari, the Gulma. Okay. Next, coming to the Samprapti or the Dosha Dusha Vivechana. In summarizing this all things, so the Nidana Sevanas. What are the Nidanas here? The Nidanas which are doing the Prakopa of Vata, the Pitta and the Kapha. For example, intake of heavy foods, the Guru Snigdha Ahara, doing Ratri Jagarna, which will increase the, which will do the Prakopa of the Vata, doing the upvasa, it will that is upvasa or the severe weight reduction. In that case, it will do the prakopa of the pitta. So this all dana sevanas will do the prakopa of kapha and prakopa of the vata. So what is happening in the gallbladder? So, due to the Vata Prakopa, there will be increase in the Khara and the Shoshaguna of the Vata. And the Kapha, it will convert the Dravaguna and the Saraguna of the Pitta into Ghana and Sthira. So, the Dravaguna, the Pitta is having Dravaguna and the Saraguna. So it is the kapha, vitiated kapha, it is converting into the ghana rupi and the sthira rupi, which can be correlated with the supersaturation of the bile, the nucleation, and the growth and the aggravation, where the crystals are forming and these crystals clump together, forming the microscopic stones. So then on the same hand, there is the increasing of the Khara and the Shosha Guna. So the increasing of the Khara and the Shosha Guna, it is giving the Murta Swarupa and hardness to the vitiated Pitta dosha, and the conversion into Ghana and Sthira rupa of the pitta, it is further binding and it is giving the sthiratva to the pitta dosha, the vitiated pitta dosha. So, end of this thing, we are getting that the drava guna of the pitta and the sara guna of the pitta, it is converting into ghana, sthira, and getting the khara and the shosha gunas. So this khara and shosha guna, that is, it is giving the swarupa of the ashmari. It is giving the hardness, and it is due to the binding by kapha prakopa, which is forming the pitashaya ashmari. So coming to its chikitsa, this was the understanding of Pittashaya Ashmari in modern terms and in the Ayurvedic terms. So we got to know that this there is supersaturation of the bile, followed by nucleation, followed by the growth and aggregation, and there is the issue in the motility of the gallbladder, and there is hypersecretion of the mucus. And here there is the vitiation of kapha and the vata, which is resulting into the vitiation of pitta, forming the ashmaris. Okay, so how we are going to treat this thing? So chikitsa, it should be based on the symptoms of the patient, how the patient is presenting to you in your clinic. Is it asymptomatic or incidental finding, or the patients are having some symptoms, or there is a obstructive cases? So, asymptomatic patients, they will not be having any symptoms, right? And it is an incidental finding. So, we can, like, the patient, it is the left to the will of the patient whether they want to get the treatment or they don't want to get the treatment for that. So, for that, we should look into the size of the stones. They might be present as the solitary stones or multiple or in the sludge form. If we ignore this, like we are not going to treat the patient, if the patient says that I am asymptomatic, like I don't have any symptoms, let me tell you what are the like complications that patient might encounter. That is, there will be obstruction in the bile duct, which will be leading to the jaundice, or it will form like it will result into cholecystitis, which will result, if that is also untreated, the patient is not taking the treatment, there will be, there are chances of perforation, sepsis, and ultimately the death. Or if we are not treating it on the in the proper time or the proper time duration, it might turn into gallbladder cancer. So the first one is the asymptomatic and the incidental finding. The second one is the symptomatic. So in cases of symptomatic patients, we can go for lakshanika chikitsa, that the patient, the presenting complaints and treating the complaints. Okay, or else we can go for the investigation to rule out any inflammation of the lumen of the gallbladder. Next, whether is it obstructing, to rule out that. After that, what are the symptoms the patient are presenting with? The GI symptoms and the colic pain. When the patient is presenting with the colic pain, the severe pain, there are chances that the patient might be having cholecystitis. In that cases, we have to refer the patient for the investigations. And in cases of obstructive cases, the first and the foremost thing what we can do is to refer the patient for CT or ERCP or MRCP to rule out the CA, because rule outing this is the main motto. We cannot keep the or put the patient life into risk by treating or by administrating the medicines. So these are the main three things which we have to give the consideration. The first one is the asymptomatic patients. The second one is the symptomatic patients. The third one is the obstructive cases. So coming to the chikitsa, the first and foremost thing, how we are planning the chikitsa. Again, the chikitsa is based on the rogas that are pitta pradhana kafanubandhi rogas, and the ashmari and the gulma chikitsa and the pitta hara chikitsas. So first one is the ashmari hara chikitsa. We can adopt the ashmari hara chikitsas and use the Ashmarigna drugs such as Punarnava, Katuki. Okay. Next, Bhumi Amlaki, we can use it here, and Punarnava. Okay, so these are the medicines which we are using as Ashmari Hara. Next, we have to do the Anulomana. Anulomana, it is necessary here, followed by Pitta Rechaka. We have to increase the motility of the gallbladder, because that is also a reason for the saturation of the bile there in the gallbladder. So we have to do the Pitta Rechana in the patients, and there should be Sneha Haram. As we know, cholesterol is the main reason here. I'm not comparing it directly with the Sneha, but we should do the Sneha Haram, and there should be Rukshanam. So we can go for Ruksha Virechana in the patients. We can surpass the classical Virechana here. We can go for classical Virechana also, but it is preferably that we should go for the Ruksha Virechana. There should be Sneha Haram, and there should be Pitta Rechana. Next, Anulomana and the Ashmarihara Chikitsa. So, what are the drugs which comes under this categories? That is Trayantyadi Kashayas, Kulathadi Kashaya, Saptasara Kashaya, Patola Katu Rohinyadi Kashayas, and Varunadi Kashayas. So this kashayas, it will enhance the bile production. Like it will enhance the liver function. It will enhance the bile production, and it will give the, or it will increase the motility of the gallbladder, so that there is no stasis, and it will do the Vedana also. Ashmarigna drugs, they are doing the Vedana, and it is doing Lekan also. Next, coming to the Bringaraja Kalkam, it can also be used as it is doing the Pitta Hara action. It is doing the Pitta Hara action, and it is increasing, it is increasing the motility of the gallbladder. Next, we can go for Shadharana tablets, Arogya Vardini Vati also, and the reference of Gomutra Haritaki, it is taken from the Pittaja Grahani. Okay, so by Gomutra Haritaki, administering Gomutra Haritaki, uh, we can give it as the Anulomana and the Ruksha Virechana also. The second last one, that is Chanda Bhaskara Rasa. This is taken from the Sahasra Yoga, the reference of Chanda Bhaskara Rasa. It does the Pitta Rechana and helps in the disintegration of the calculi in the lumen. Next, the tablet, that is Pitorin. That is, it is not a classical medicine, but it is widely used for the gallbladder stones, in the reduction of gallbladder stones. So such medicines can be inculcated in our treatment modalities, which is doing the Ashmarigna action, which is doing the Anulomana, which is doing the Pitta Rechana. Okay, so Chandavaskara Rasa, it is having Jayapala along with the other drugs. It is doing the Pitta Rechana. There will be after administering of this medicines, there are Vegas, like the patient will be having 2 to 3 Vegas. So it is doing the Pitta Rechana uh, action. Next, coming to the Patya Patya. So what we in OPD basis, what we should advise the patient, what they should take as a patya and what is apatya, because it is a sedentary lifestyle disorder. It is related to sedentary lifestyle. There is obesity is the reason here. The sudden weight loss is the reason here. So uh, I believe that patya patya plays a major role in avoiding such disorders, or to avoiding the initial stages. We can avoid the patients uh, who are prone for these disorders. So we have to advise the patients to take lagu ahara, which are freshly cooked aharas, which are lagu in nature, and to avoid the fried and oily items which are having high oily things which are fried. It should be avoided in any form. The upvasa, the drastic reduction in the weight, it should be avoided. The patient should follow a disciplined route to reduce his or her weight. They should not run behind reducing the weight in short duration of time. Next, we coming to the patya, we can give the mulaka, the radish, because it increases the motility of the gallbladder. Next, coming to the kukuta mamsa, the chicken. It is low in low fat content, and again it will re- increases the motility of the gallbladder. Next, we can give the kulatha. It is also ashmarigna, and it is helping in the uh, what the increasing the motility of the gallbladder, the working of the gallbladder. So we can give the mulaka, kulatha, and the for the non-vegetarians we can tell the patient to take the chicken instead of other forms of non-veg. It is preferable. So all the light foods and the uh, which are easily digestible. And coming to the sleep schedule of the patient should be proper. The patient should have proper sleep the night, because doing having anidra, it is again vitiating the pitta. The ratri jagarna, it will vitiate the vata. That's why it should be avoided. The diva swapna should be avoided because it is again causing the uh, kapha vitiation. So all these disorders, like what we are following in Shakashrita Kamala, the treatment in Shakashrita Kamala or the treatment in Pittaja Gulma or in the Ashmari, that can be or that should be used or utilized in the treatment of Pittashaya Ashmari. I hope the concept is like what I'm trying to deliver, it is understood by everyone. So by this I'll stop my presentation. Thank you everyone.